Madam Speaker, I rise to ask question number 159 of 2015 under my name in today's order paper. And the question is to the Honourable Minister for Health and Medical Services. Can the Minister inform the House on how Fiji is dealing with the impact of tobacco on health, and how has it responded to the World Health Organization Framework Convention on Tobacco Control, which Fiji signed and ratified on October 2013? Thank you, Madam Speaker.
Thank you. I give the floor to the Honourable Minister for Health and Medical Services.
Thank you, Madam Speaker. I rise to answer the question posed to me by the Honourable Member. The World Health Organization Framework Convention on Tobacco Control basically sets out to do two things. It sets out the steps that countries would need to take to reduce tobacco use because of the consequent harm and suffering that arises from its use. That's the first. And the second, it also includes initiatives, things that we can do in order to reduce the demand for tobacco and also to control its supply. So these are things that countries need to do because of the impact that tobacco has on the health of the people in the world and the people in the country per se. In Fiji, there had been work on tobacco that commenced much earlier than this framework. In fact, from the records, it shows that tobacco control initiatives started way back in 1997. And there was a legislation that was passed, the Tobacco Control Act that was passed in 1998, and enforcement commenced in 1999. The Tobacco Control Enforcement Unit therefore started around 2002 with 2 full-time staff. But in responding to the Framework Convention on Tobacco Control, the government has amended its tobacco control laws through the Tobacco Control Decree of 2010 and the Tobacco Control Regulations of 2012. What these did, they basically amended the Tobacco Control Act of 1998. And there were additional components added on to that original legislation in the tobacco control laws, and laws that apply to tobacco products, example, customs and taxes. The most effective way of dealing with tobacco and its impact on people is to have population-wide policies. Populations like bans on advertising, on promotion, and sponsorship of tobacco products. We need things that run across the whole gamut of the whole country. We need strategies on tobacco tax and price increases of tobacco. We need policies that forbid smoking in public and workplaces. And we need policies and laws that require large, clear and visible graphic health messages on tobacco packaging. I am glad to inform this House that all of these measures have already been implemented by the Ministry of Health in its tobacco legislations. Fiji is now the only country in the Pacific to sign the Illicit Trade in Tobacco Protocol in 2013. There are 54 other countries that also signed that particular protocol, but only one country has ratified it. That's Nicaragua. We are now looking also here in Fiji to also ratify that protocol. Furthermore, as a signatory to this convention on tobacco control, the convention requires us to put into place activities to help people stop smoking, smoking cessation. So subsequently, the ministry has been carrying out training for medical staff. We have a toolkit on NCDs and pen training so that they can help people, they can counsel people to stop smoking because of the impact this is having on itself. In 2008, to make sure that we can have a greater impact right across the country, as part of the tobacco control, in the Western Division, we have set up 3 tobacco control officers, and the Northern Division, another additional 2 officers to complement those who are already in Suba. These enforcement officers actually go out and make sure that the laws are being applied. This year, as a result of all of these activities, Madam Speaker, earlier this month, the World Health Organization looked at the activities that we are doing here in Fiji to try to control tobacco and its usage, the activities that we are doing to control the illicit trade in tobacco, and they recognize us. They gave us a gold medal and a certificate. This is not done for all countries. It is done for countries that have been able to progress this. So we hope that we continue to move along this path, to have less and less numbers of our people and our young children smoking cigarettes or suki or whatever it is, so that they can look after their health and they can have better futures. Thank you, Madam Speaker.
Thank you.
Supplementary question.
Supplementary question. I invite the Honorable Kiliraki.
Supplementary question, Madam Speaker. It's commendable the answer that has been highlighted, or we are enlightened with this morning at the end of the chain of prevention or deterrent of influencing people to smoke. But my question is, what is the policy of the government for the people that are planting tobacco, as well as there's a factory that manufactures tobacco in the country? It'll be interesting to receive the answer in the interests of the farmers as well as the company. Thank you, Madam Speaker.
Thank you, Honorable Minister.
Thank you, Madam Chair. We know that there are, while we understand that there is a need to sort of limit the smoking of tobacco because of its harm on people's lives, but at the same time, we have to balance this with the livelihoods of people. I think over the long term, if possible, we would need to look as a nation to see people to move away from crops that can harm people's health. But at the time being, we need to live with realities. People are living on tobacco at the moment. There's a tobacco company plant that also employs people. So there's always, in life, there's always looking at the balance between health on one part, and on the other part, we look at employment and the things that come out of employment. So at the moment, our policy is to balance these things so that we can see as much as possible we can have a win-win situation.
Thank you. I now call on the Honorable Mikhail Leawere, who stood up first.
Thank you, Madam Speaker. I thank the Honourable Minister for the resolution in relation to the tobacco control. I would just like to ask the Minister if it's possible to legislate if the tobacco packages or cigarette packages to be either in plain black or plain white to discourage people from buying cigarettes. Thank you, Madam Speaker.
Thank you. Honourable Minister.
The suggestion is noted, Madam Speaker.
Thank you. I now call on the Honourable Nico Nawaikula to have the floor.
This is a very, very popular convention that every country in the world rushed to ratify. But Fiji, according to this, only ratified in 2013. So the reason we ask is the delay. Why the delay? That government has been in power for 9 years.
9 years, yeah.
And they only come to ratify this on the 7th year.
Thank you.
Could you explain the reason for the delay? Maybe sleeping, fishing, or whatever.
Thank you. The question is clear. I give the floor to the Honourable Minister.
Madam Speaker, I'll need to go back to see the date of the convention. I think the convention, I'm not too sure what the date is, but I'd like to point out the emphasis on what we really need to look at is what we are doing on the ground. The tobacco enforcement activities have been commenced well before that. So even though we ratify or we sign it and we ratify later, what we really need to see, the proof on the pudding, as we say on this side, is the execution of what we do so that it has an impact on people's lives. We can talk until the cows come home. We can talk until the cows come home, but what counts is execution. People are... Those must be the Vanua level cows. These are cows on what we do now. Thank you, Madam Speaker.
Thank you. Please ensure that the cows don't enter Parliament House. Thank you. I now give the floor to the Honourable Dr. Biman Prasad.
Thank you, Madam Speaker. With respect to tobacco control and consumption, can the Minister inform the House why 400,000 that was retained for NCD activities out of the 700,000 that government collected from annual licensing of importers, wholesalers, retailers in 2015, why was that 400,000 retained to government with no return to NCD activity from that allocation?
Thank you. The onus is on the Honourable Minister to answer or not to answer.
Madam Speaker, that's a new question. You'll have to repose it and then I can answer it.
Thank you.
Madam Speaker, point of order.
You are allowed only one. Thank you. Point of order.
Madam Speaker, the question was directly relevant. It was in relation to tobacco control and consumption. And the allocation, the revenue that government got, 700,000, 400,000 of that in 2013 and 14 is to go for NCD activities. In 2015, that 400,000 was returned to government. It did not go to NCD. It's a very relevant question. If you want to control tobacco.
Thank you. You had unasked. Order. You had asked a supplementary question and an answer had been given. Thank you. I call on the Honorable Anurivande to have the floor.
Thank you, Madam Speaker. I just want to ask the Minister or the government whether they consider increasing the tax on tobacco in this budget to deter more smoking as a #1 step being highlighted for their resolution in this issue.
Thank you. I give the floor to the Honorable Minister.
Thank you, Madam Speaker. I think if the members of the other side had been here during the budget debate, they would have noticed that the taxation increased, wherever it was. If there's one thing in which we continually increase tax every year, it is alcohol and tobacco. The sin goods, because we want to deter people from using this, because it has an impact on their lives, so it happens every year. And I believe it will happen again in the future.
Thank you.